Why fitness? My name is Alicia Tangis. This is for COL100, spring of 2017. While I have not chosen a career path, I do know health sciences is my focus with special attention to physical fitness and athletics. In this presentation, I will explore health-related motivations promoting physical activity and fitness. Over 20 years ago, the World Health Organization stated, "There is worldwide acceptance among medical authorities that physical activity is an important element of healthy living," as cited in Biddle, Fox, and Boucher 2000. The importance of physical activity. By exploring in depth the various physical and mental health benefits of physical activity, I can provide real motivation for physical fitness. I am pursuing a degree in sports and health sciences. Physical activity is a primary focus of that degree. Let's examine the reasons to focus on fitness. I will be examining mental benefits, physical benefits, and children's health and development. I will also define fitness or physical activity as I am using it, and visit the possible negative impact of physical activity and fitness. Exercise is more than just an art of converting big meals and fattening snacks into back strains and pulled muscles by lifting things that do not need to be moved or running when no one is chasing you. Anonymous quote. Let's explore the mental health benefits. What mental health benefits are gained from physical activity? Major mental illnesses and diseases are beneficially affected by physical activity. Depression. Investigating clinical depression and the effects of physical activity, Biddle et al. Found exercise programs, both aerobic and non-aerobic, can reduce clinically defined depression, and that the reduction of depression is of the same order as that found for a variety of standard psychotherapeutic treatments. Furthermore, these antidepressant effects are feasible in a short time frame, 4 to 8 weeks, and persist from 2 months up to a year. What a difference physical activity can make lasting up to a year. Schizophrenia. Van Kampfert et al. Found there is evidence that aerobic and strength exercises and yoga reduce psychiatric symptoms, state anxiety, and psychological distress, and improve health-related quality of life, that aerobic exercise improves short-term memory, that progressive muscle relaxation reduces state anxiety and psychological distress, and that physical training therapy in general offers added value in the multidisciplinary care of people with schizophrenia, as cited in Peterson and Saltine, 2015. Although there is no evidence that physical activity can be only therapy for schizophrenia, it has great potential as an add-on treatment for patients. Bipolar disorder. Studies have found that at least 3 days per week, 45-minute moderate to vigorous aerobic exercise was as effective in reducing depressive symptoms as an antidepressant. Sylvia Amitrano and Nirenberg, 2010. However, using physical activity as therapy has only had case-by-case success, with doctor and patient efforts to balance the depressive symptoms with the manic symptoms. In all the sources I found, there is a call to further study in the relation of exercise and bipolar disorder. Using physical activity to balance. The reasons why physical activity affects mood, stress, and anxiety is a combination of increasing core body temp, serotonin output, endorphin engagement, and distraction. Biddle et al. Found exercise training has been used successfully to reduce trait anxiety in a wide range of clinical and non-clinical settings. However, some anxiety disorders, such as panic disorder with agoraphobia, would not respond to exercise training. You can use physical activity to boost confidence. Physical activity is important to self-perception and self-esteem. Biddle et al. Found many ways that physical activity boosts internal judgment. Among the benefits of physical activity, there are studies reporting enhanced body image, body satisfaction, or body acceptance through weight loss or improved muscle tone, enhanced perceived physical competence through improved abilities, prowess, and aspects of fitness such as strength and cardiorespiratory function, enhanced sense of autonomy and personal control over the body, its appearance and functioning, improved sense of belonging and significance through relationships with exercise leaders or others in the exercise group. This graph shows a difference in 7 days of 20% increase in internal judgment from Gallup poll. What a difference. Let's look at what physical health benefits are gained from physical activity. There are a multitude of diseases that have benefited from the use of physical activity as an add-on treatment. An article by Peterson et al. Identifies 26 common diseases that respond positively to aerobic activity. I will focus on some of the most common diseases. Heart disease. Studies found that over the wide range of cardiovascular diseases, physical activity helped regulate symptoms such as lowering blood pressure and decreasing hypertension, and improved overall prognosis, less acute heart incidences. Peterson et al. Type 2 diabetes. 80% of diabetic patients are overweight. Peterson et al. Regular exercise can help insulin more effectively lower blood sugar levels. Mayo Clinic. Arthritis. Exercise can reduce pain, help maintain muscle strength, and reduce joint stiffness. Mayo Clinic. And can be as effective as prescribed injections for hips and knees. Peterson et al. Asthma. Exercise can be used to control the frequency and severity of attacks by focusing your attention on breathing techniques. The Mayo Clinic. The American Heart Association has put out a chart for 2015, published on December 8, 2016, showing heart disease is a leading cause of death. You can see stroke in there and diabetes as well. The effects of physical activity on weight loss efforts and resulting resolution of health issues. This is a section that leads to the chicken and the egg question. Which comes first, the disease or being overweight? Obesity contributes to cardiovascular diseases and diabetes, among other health risks and lifestyle challenges. Exercise has been documented to lower blood pressure, lower cholesterol levels, and improve the immune system. Losing weight also leads to more energy. The Active Times, 2017. It is well known that physical activity increases the metabolism, leading to weight loss. Strong evidence exists that physical activity is important for preventing weight gain in general, as well as maintaining body weight after weight loss. Peterson et al. What health benefits will physical activity have in a child from birth to adulthood? The physical developments. Physical activity development encourages development of fundamental motor patterns and transitional motor skills, leading to motor competence. Starting and maintaining a healthy routine of physical activity will enhance motor skill and competence. Strengthens bones, muscles, and increases flexibilities. Studies have proven physical activity enhances the mineralization of bone at an early age. As Bloomfield et al. Found, physical activity may reduce osteoporosis-related fracture risk by increasing bone mineral accrual during development, by enhancing bone strength, and by reducing the risk of falls by improving muscle strength, flexibility, coordination, and balance, as cited in Cole and Cook, 2013. Encouraging physical activity at a young age also develops lifelong health habits. There are many studies showing brain structure and function is positively affected by physical activity. The brain volume in certain areas of physically active children is measurably larger. Chaddock et al. Physical activity improves overall academics with focus on reading and math. Chaddock et al. Examined large studies of up to 884,715 children, concluding that they identified positive associations between components of aerobic fitness and overall academic achievement, reading achievement, and mathematics achievement across grade levels. Physical activity enables the same mental health benefits in children as adults, with the addition of encouraging psychosocial confidence through physical achievement. Cole and Cook et al. Report, research supports the positive impact of physical activity on the overall psychological health and social engagement of every student. Regularly active children have higher self-esteem regardless of whether they participate in structured sports with peer interaction or more free-flowing exercise programs. let's look at how physical activity or fitness is defined and what is the right amount. Fitness is best construed as a set of attributes, while physical activity more generally refers to behavioral actions. Chaddock et al., 2011. Recommended doses. A broad overview for large population variations is at least 30 minutes of moderate to vigorous aerobic activity per day for ages 17 to 64, and at least 60 minutes of moderate to vigorous intensity aerobic activity every day, ages 4 to 17. Physician or trainer recommendations are based on individual specifications. Personal trainer pre-screening questions from the National Federation of Personal Trainers and physician questions from the National Academy of Sports Medicine and Exercises Medicine, 2017, for exercise prescription are similar. The trainer will implement programs working towards goal, and both the trainer and the physician can determine what exercises are safe for each individual based on contraindications. The specifications that both the physician and trainer focus on are age, sex, body mass index, goals, and contraindications. Wouldn't it be nice if this was the only prescription any of us ever see? Current perception of physical activity needed to achieve and maintain fitness. Let's look at chronic activity versus acute activity. Chronic activity has better outcomes as opposed to acute activity, chronic being 12 weeks or longer. Biddle et al. Found several types of exercise are effective in changing self-perceptions, but there is most evidence to support aerobic exercise and weight training, with weight training indicating greatest effectiveness in the short term. The extreme training programs used by celebrities may not be the best method to achieve lasting fitness. Simple routines have great outcomes, no need for laborious fad fitness methods. That does not look as fun as it could be. Are there negative aspects that would impact physical or mental health within physical activity or fitness? Psychological dysfunction. Studies examining physical activity as a psychological dysfunction use the term in isolated cases, Biddle et al., emphasizing the rarity of occurrences. Biddle et al. Also found the most common psychological dysfunction associated with overexercising is exercise dependence. It is a form of behavioral addiction. It can lead to both injuries and to neglect of other important responsibilities in life. Exercise dependence is not to be confused with exercise commitment. The possible physical injury and health problems resulting from the injury. An injury sustained during physical activity can lead to downtime and the resulting loss of fitness momentum. Getting into a routine takes time and effort. Any injury can disrupt a good exercise program. Generally, non-competitive exercise injuries are not major. Some of the most common injuries are rotator cuff tear, ACL injuries, runner's knee, shin splints, and mild sprains. Lack of knowledge can also lead to possible injury. It is common knowledge that stretching before exercise, but is it common knowledge why? It is an important part of an exercise routine. Stretching can be used to reduce risk of muscle, ligament, and tendon injury. Serious injuries involving exercise equipment, predominantly treadmills, contributes to the exercise injury numbers. Lack of knowledge in the use and safety features of these machines is a big cause of injury. Graves et al., 2014. Many exercise-related injuries are preventable, most are mild, and the majority will respond to treatment at home. American Fitness, 2010. Let's get fit. It is my hope that by exploring these mental and physical benefits, we can all be motivated to be physically active. I hope you enjoyed this presentation. Thank you for watching.